I am Dibyendu Bhattacharya, residing at Howrah near Mandirtala. I work in West Bengal State Electricity Transmission Company in the capacity of Chief Engineer. I was first detected with heart problem in 2009. At that time, at the very early stage, the reports were very bad. But I consulted many doctors and they kept me on medications. 2017, I had to implant AICD, but still my conditions never got much improved. There was breathing trouble, and during these puja days, on 19th October, the day before Lokhi Puja, I was suffering from severe breathing trouble. I was brought to this Narayana Superspeciality Hospital, and temporarily the doctors gave me some medicines, and I just temporarily recovered, and doctors advised me so that I can go for a heart transplant as early as possible. And I joined my office on 29 October, but again on 6th November, I had to admit him in this hospital due to similar trouble, and our doctors told me that my heart is on the verge of collapse, so I need to go for heart transplant as early as possible. This was advised by Dr. Debasis and Dr. Munna.
Hello everyone, I am Dr. Debasis, consultant cardiac surgeon from Narayana Superspeciality Hospital, Howrah. This is just to share a story of a patient, Mr. Dibyendu Bhattacharya, who was suffering from end-stage heart failure and had recurrent admissions in our hospital. Ultimately, after a heart team decision, we enlisted him for a transplant and were lucky enough to get an organ within a month of enlistment. So in the month of December, there was a donor heart available at SSKM hospital, and he underwent a successful heart transplant in our unit. This was our 4th heart transplant and 3rd in the year 2021. He made an uneventful recovery and went home at 20 days post-operatively and has recovered well after that. This is just to give a message that end-stage heart failure is a problem in a selected group of patients in which no other options work medically. Those are the patients who benefit from advanced therapies like left ventricular assist devices or heart transplant, and all these facilities are available in the unit and in this part of the country at par with the rest of the world. So just wanted to share this positive message of a successful heart transplant. Thank you.
Hi everybody, this is Dr. Munna, consultant interventional cardiologist and heart failure physician at Narayana Superspeciality Hospital in Andul Road. Myself, I am looking over the advanced heart failure clinic that is attended by patients who have symptoms of breathlessness and fatigue, weakness, pedal edema, that is fluid accumulation in the body, and other symptoms that are related to weakness of the heart, that is heart failure, and those patients who are not responding to the usual therapies, usual medications. There we triage such patients regarding optimizing their heart failure therapy, trying to formulate a plan of management so that they can be cared at home, advising their home therapies, organizing them, as also offering certain devices and other therapies, including rehabilitation programs for patients who are advanced into the disease process, that is having advanced heart failure with a very weak heart. There we offer them therapies like heart transplant, ventricular assist devices, CRTs for patients who have electrical problems and qualify for the device, as also revascularization strategies like CABG or PTCA, that is angioplasties, whoever benefits from them. Mr. Dibyendu Bhattacharya was one such fortunate patient who was under my care for heart failure in the advanced stages, was not responding well to medical therapy, and therefore he was enlisted in the heart transplantation list, for which he was sort of selected, and thereafter he underwent a successful heart transplant within 1 month of his enlistment, and he is doing extremely well after that, and he has returned back to his usual activities within 1 month of this transplant. He is back with his family, with all his family's expectations and joy met. So we encourage the entire mass, whoever is listening to this video, is to enlist yourselves for organ donation, because unless you come forward to donate an organ, be it a heart, liver or kidney, it is impossible to salvage such patients. Such posthumous organ donation pledge should be a must and a duty from ourselves as a citizen towards the society, and we look forward to increasing the volume of heart transplants in our center, as also carry out the advanced heart failure clinic in a further refined way to cater to the individual needs of such patients in a holistic way.